Okay, Christophe, I think we can start. I think we have right now all our panelists online, and so we can start. Please, the floor is yours, Christophe. Thank you.
And good morning, afternoon, everyone, and welcome to our numerous international participants to today's webinar about EL 4.0 in the post-COVID-19, small and medium healthcare companies at the forefront of innovation. My name is Christophe Michele, and I'm honored to act as the moderator for this exciting webinar, and would like to thank the organizer EUCOPE for this great opportunity, of course. As a short introduction about myself, I'm a senior director with Invoice and Consult in Life Sciences, and our company is a leading provider for the design and operational implementation of international regulatory and market access strategies for digital health technologies. I will now like to hand it over to Dr. Alexander Natz, Secretary General from EUCOPE, for some opening remarks. Alexander, please.
Thank you very much, Christophe. It's a great pleasure to welcome you all today to our event on digital health and AI in the post-COVID area. And it's our first event on this topic. We have an impressive lineup of speakers, which I'm sure will sparkle very interesting discussions. My name is Alexander Natz. I'm the Secretary General of EUCOPE. Many of you might know EUCOPE. EUCOPE is representing small to mid-sized companies active in the field of pharmaceuticals and biotechnologies, but also increasingly in the field of digital health, AI-based technologies, and also medical devices. So, as demonstrated by the fight against COVID-19, artificial intelligence has the potential to drive change and improve efficiency and accessibility in healthcare very much. So I think it's really something also the Commission looks very much into artificial intelligence when it comes to the pharma strategy. From compounds design and medicine developments to faster patient screening and diagnosis to hospital management, just to name a few applications for AI-based solutions. And these solutions can help to upgrade our healthcare system towards more sustainability while helping to address patients' needs at the same time. To realize this potential, it appears certain that a fit-for-purpose regulatory framework that enables safe data sharing, accelerates the rollout of personalized medicine and diagnostic solutions, and drives a solution in AI is essential. And this is really what we want to discuss today. So today's event is really to understand how the EU can be a leader of innovation for an efficient, patient-centric digital health. We will hear the priorities of the Portuguese presidency and the ambitious plans of the European Commission, notably on the EU health data space. And we will discuss how it can really make a difference for patients and industry. The event is also the opportunity to officially publish EUCOPE's white paper on AI, where we, together with our members, have put forward some concrete proposals to tackle the challenges impacting the adoption of AI in healthcare, namely data challenges, the regulatory framework, and the validation process. We also focus on the specific hurdles for smaller companies. For instance, the access to capital, skills, and data to ensure players are all on an even playing field in this matter. This is a critical time for digital health in the EU. For many years, we have seen projects around e-health, mobile health, and now we are talking more about digital health. But there is clearly a unique momentum right now. The European Commission has set AI very high on its agenda in terms of improving the competitiveness of the continent towards other countries, but at the same time, spearheading the debates on ethics, a key factor to enable and improve trust in those services. So what is the bottom line here? How do we ensure trust, adherence to AI-based technologies? I'm happy to have the patients with us today to give their unique perspective as end users of this innovation. Again, let me thank you very much for joining us today. Let me thank the organizers, especially Laurent and Christophe, for such an impressive agenda. And without further ado, let's move on with the debate. Back to you, Christophe, and many thanks.
Thank you very much, Alexander. And I think it's probably now time to hand it over to Laurent for the polling question to the audience before moving further with the first keynote speaker.
Absolutely. Thank you, Christophe. Indeed. I mean, to a little bit start the discussion and to set the debate of today, I think we can start with a very quite open, I would say, polling question. So I will start it right now. I mean, basically, it's what is in your view the biggest hurdle to the adoption and development of digital health and AI in health? Now, it's a very broad, of course, question, and it's, of course, you have multiple choices. And I will let the poll run while we also have maybe the video message from the Portugal ambassador, Pedro Lurti. And we'll get back to the polling results. I see it's already moving a lot, so thank you very much to the voters. And maybe we can come back to the results of the polling after Ambassador Lurti video message, if that's okay with you, Christophe.
This is perfect, Laurent. Thank you very much. So without being said, I would like to introduce our first keynote speaker for today, namely the Ambassador Pedro Lurti, Portuguese Permanent Representation to the EU, who is going, as said, to present us in a video speech the priorities of the Portugal presidency of the EU for digital health. So in a nutshell, Mr. Lurti acts as the Deputy Permanent Representative, as said, for Portugal to the EU since 2016. He entered the Portugal Diplomatic Services in 1995, was Secretary of State of European Affairs in Portuguese government from 2009 to 2011, and is a former ambassador for Portugal in Tunisia. Mr. Lurti has also a degree in economics from Lisbon and has a master in European economic studies from the Bruges College of Europe. So with that being said, Laurent, could I please kindly ask you to
Yes,
launch Mr. Lurti's video?
Absolutely. Yeah, let me try to share my screen and share the video. And after the video, so we'll get the polling results, and I will also share some information about the chat and the Q&A as well. But let's first try the video.
Good day to all. It is a pleasure to be recording this video message on the occasion of the EUCOPE event. I am very sorry that I cannot be with you physically, but it is my pleasure to have this video message on the main priorities of the Portuguese presidency on the health sector, and most specifically on the digital health sector. As you know, beginning of 2021, it is obvious that health issues are one of the dominating issues also on the European agenda, and so it is not without it is not with any surprise that you will find that in the program of the Portuguese presidency, the health issues have an important space. First and foremost, because we are living in the COVID-19 pandemic, and it is our common effort to overcome this pandemic, hopefully through the vaccination process that is now ongoing throughout Europe in all the member states. There are other areas in which the Portuguese presidency will develop its work on the health area. As you know, we have a legislative work on our table on the Union on the Health Union that the Commission presented at the end of 2020, and this legislative work will continue, and we will try to move it as swiftly as possible during the Portuguese presidency. But I wanted to talk to you also more specifically on the theme of this conference on digital health, the digital transformation of the health sector, which is a reality, as you know, notably by means including telehealth and telemedicine, with a view to improving the quality of healthcare and reducing inequality in access to health. The Portuguese presidency will try to promote this, notably through the interoperability of the electronic health records, with the view to boosting reuse of clinical information. There is notably a specific event related to this. We will organize a high-level conference on digital health, Portugal eHealth Summit, to be held, we hope, in Lisbon in the month of June. So I would also like then to take the opportunity to refer to specifically artificial intelligence and the EUCOPE's work on it, notably through the white paper, where it is clearly stated that artificial intelligence represents a historic opportunity to redesign healthcare in Europe. Indeed, AI can be deployed in just about any activity of the health sector, from clinical decision-making and health services redesign to biomedical research and drug development. AI clearly presents an opportunity for health services, notably national health services, which we all know are under pressure. This can be achieved by leveraging health information, so to support policy planning, to support decision-making and research. In other words, it is an opportunity to move towards a health promotion and disease prevention approach. I think there are a few areas that we need to have in mind, and I think the Portuguese presidency will try during the debates, notably at the event that I've just mentioned, also put forward those elements. To move in this direction, we need that long-standing barriers that still constrain the reuse of health data need to be removed. Interoperability and data access and quality are key. We also need consistency across jurisdictions and health systems. This is instrumental to foster a European health union in which standardized, coherent, and accessible electronic health records can be exchanged for the greater good of our countries, of our communities. To operationalize these outcomes, the envisaged European health data space plays a major role in promoting consistency, precisely this consistency between and within member states, and we hope that the Portuguese presidency can continue also at the level of the Council of the European Union these debates among member states. So these are the messages that I would like to convey. Health has become, as you all know, a central part of the discussions among member states, due notably, of course, to the pandemic, the COVID-19 pandemic. But there are also a lot of lessons that the European Union is still in the process of acquiring from this experience. One thing is certain: working together in the respect, of course, of national competences is absolutely essential, not only to overcome the COVID-19 pandemic, but also to improve the way we can deal at European level with health issues. And digital health is definitely one such area where we can cooperate further in order to move forward. Thank you very much for your attention. And again, I apologize. I'm very sorry I'm not able to be with you physically, but I'm glad that I can send you this video message. Thank you very much.
Okay, Christophe, yeah, back to you.
Yeah, thank you very much, Laurent. Again, a really inspiring message is delivered by Mr. Luthi regarding the promising future, I will say, of the European Health Union, and priorities set as well on improving data access and quality to really foster healthcare innovation. we'll actually, this first key message is being already shared with the audience. Laurent, is it a proper time for sharing with us the responses to your poll?
Absolutely, Christophe, and well, it's a very very tight race, I have to say. But from the different voting, I think that we can say that we have with 48%. The issue of interoperability is definitely well, the most pressing or most, let's say, the biggest hurdle to the implementation of AI and digital health. Then also very close, just behind as a second position, the regulatory framework, and then we can see also trust and data protection tying for the third position. So I guess really no major surprises here, but I think it really underlines the issue at stake, and that you know, hopefully it will also drive a little bit the discussion of today's panel. Just to, if you allow me, Christophe, one very quick note on the interaction with the audience. So I will be keeping an eye on the Q&A and the chat. So if you have any questions to the panelists and also to the MEPs afterwards, please feel free to ask your question in the Q&A. And I will be reviewing the questions, and then we will have time for a short Q&A sessions after each panel. So that's it for me. Yeah.
Thank you very much, Laurent. And indeed, I think this poll is just confirming that we're heading in the right direction regarding the different axes we would like to explore during today's webinar for sure. I would like to propose you now to start with our initial discussion with our business and EU executive. And as indicated by Laurent, time will be left at the end of this first session for Q&A with the different speakers. So it's my pleasure to welcome and introduce our presenters for this first session. First one being Sari Thompson. So Mrs. Thompson is Deputy Head of the e-health Wellbeing and Aging Unit in the DG CNECT. Prior to working on digital health policy within the Commission, Ms. Thompson worked for Eurostat and for the DG Santé. And before joining the EU institution in 22, Sari worked on global health policy at the UK Department for International Development for QPMG International Healthcare Practice. And also on epidemiological research project in the UK and Brazil. She has a degree in mathematics from Durham University, UK, and a Doctor of Public Health from the London School of Hygiene and Tropical Medicine. Our next speaker is actually Dr. Lubana Bouafa. Mrs. Bouafa is a machine learning scientist turned entrepreneur. She's the founder and CEO of Okra Technologies, an artificial intelligence data analytics company for healthcare. Lubna has been a member of the European Union high-level expert group on artificial intelligence, where she's particularly focused on healthcare and in achieving competitive business impact with AI. She was named on an MIT Technology Review Top Innovator Under 35, a Forbes 50 Top Women in Tech, and also won several prizes, including CEO of Year 2019 at the Cambridge Independent Science and Technology Awards, and also Best Female-led Startup at the Startup Europe Awards. Next, we'll have Michele Calabro. Michele is a policy advisor at the European Patients Forum, where he leads the forum's activity on digital health policy. Before joining EPF in 2020, Michele worked as policy and communication manager at the European Health Management Association. Michele is also part of several youth health policy networks, including the Young Forum Gastein, currently as a World FG Task Force member, and also the European Health Parliament Alumni Group. Last but not least, we also have João Duarte. Mr. Duarte is currently Chief of Staff and Regulatory Science within the Global Regulatory Affairs team at Alexion Pharmaceuticals, heading the Regulatory Intelligence and Policy team. He held several roles since 2012 in Regulatory Intelligence and Policy, notably at Lundbeck and Takeda. And João represents Alexion Pharmaceutical in several EUCOPE groups and was one of the EUCOPE's representative at the EMA focus group on qualification of digital technologies for medicines development. Finally, João is a pharmacist by training, graduating from the University of Lisbon, and also obtained a Master of Science in Pharmaceutical Medicine from Trinity College Dublin. So without waiting longer, let's now get into the content.
Christophe?
Yeah, go ahead.
Just to jump in quickly, because we are really also lucky to have MEP Romana Jerkovic with us already on the panel. Mrs. Jerkovic, I know that you are scheduled for the 5 p.m. panel, but thank you anyway for being with us already and to listen to our discussions. Just also to, we will also have MEP Sean Kelly joining us later on, but I just want to thank you, MEP Jerkovic, for already attending the discussions, and it shows great interest, and thank you again. And now I'll let you, sorry, Christophe, please, let's start with the panel.
No issue, Laurent, and of course, welcome, Mrs. Jerkovic. We're planning on having your complete bio presented for the next session of the webinar together with MEP Sean Kelly indeed, but thanks a lot, Laurent, for the actually for the point. Basically, I think it's probably now time, as said, to enter into more discussion and content. So with all of that being said, Sari, the floor is yours, I think.
Thank you very much. And I'm very privileged and happy that you've invited me to join this exceptional panel today. And it's a pleasure to present the European Commission's perspective on the topics that you're raising in relation to digital health, artificial intelligence, and the European health data space. I think, well, first, I think we can't start without a reference of to the current situation of the pandemic, which has been quite significant, of course, for digital health, because on the one hand, it's shown us, how much we need digital health, how much we need digitalization in the health and care sectors. And we've heard from the struggles that countries have faced in trying to appropriately treat their patients and move them around health and care systems without having this easy ability to share information across borders on their condition, where in the early days, at least, they wanted a critical mass. And, we've seen how critical it is. And yet at the same time, society has managed to really build on the shoulders of what has been achieved in digital health. So I think that we have digital health and artificial intelligence and high performance computing very much to thank for the speed with which the vaccines have been developed. So because thanks to the early days of sequencing the virus quickly and so forth. So we're at this interesting point in relation to digital health. But from the Commission's perspective, of course, the pandemic has made us understand that it is really important now to accelerate the plans that we already have, and we do already have a number of plans. And so it's very important, I think, that we'll see in the coming years as the pandemic dies down, that this focus recently on digital health doesn't die away, but in fact, it just keeps growing steadily and becomes more and more taken up around health and care systems and in the sort of research and innovation fields. So if I could just then give you a bit of a run through of what we're doing from the European perspective. I mean, we have been working for some time now on developing the frameworks, so the trust frameworks, and this is trust, for example, in relation to cybersecurity frameworks, all the extensive work we've done on artificial intelligence, to really think about the principles and the ethics behind this. And Lubna, of course, who will talk later, has been very, very deep into this work. And what's coming up next will be a regulation on artificial intelligence in the first quarter of next year. And this will take the story forward again and have relevance particularly to the health and care system, with looking at issues around safety and fundamental rights of tools based on AI. And more generally, the data strategy that was published this February 2020 has launched then a large number of different pieces of work around each designed to do a little bit more around developing this framework for data and ensuring that data can be moved freely that we have the infrastructure to do it, that we have the interoperability to do it, that we have the trust and the security to do it, which is so essential for health and care. And I'm glad that it was raised, the issue of interoperability, by the Portuguese speaker, because a key thing that we adopted in 2019 was a recommendation of a European electronic health record exchange format. And this is a very important piece of work which we're now investing in a project to further develop, which took stock of where Europe is in relation to common technical specifications for health data sharing, and proposed the next priority set on for which we have to develop common technical specifications. So we have a project working on that right now, and I think over the next so many years, with investments coming that I'll just mention in a moment, we'll hope to see this more and more taken up across health and care systems across the EU. So we have a number of investments planned, and continue in addition to the frameworks that we're developing and filling out. We've already had a lot of investments. I mean, in relation to, for example, supercomputing, the Commission had set up a platform during COVID, which was all about, which invited pharmaceutical companies to come and donate molecules together, and then to analyze them rapidly using supercomputing to see which drugs could be repurposed for tackling COVID. And now that this platform has been set up and huge investments have taken place in supercomputing, we want to see these, of course, rolled out to more and more parts of health and care, to cancer, to diabetes, to different priorities of health in the European Union. But we also intend investments in, for example, uptake of artificial intelligence, more infrastructure, skills across the board in the health and care sphere, capacity building. We need to see capacity building in health and care systems, for example. We need to have more capacity in relation to the ability of data holders, such as hospitals, to be able to store and process and securely share health and care data. And in terms of the sort of financing that's going to go into this, we've got a number of programs. We've got the Recovery and Resilience Facility, which has a budget of over 600 billion, and it's been decided that 10% of this should go towards digital. So this is already a huge sum across all digital, which with a large share in the light of COVID will of course fall onto the health and care systems as well. We've also got the Digital Europe programme and the new EU for Health programme, which has recently been arranged with a budget of approximately 5 billion. We've got regional funds, we've got continued work under the research funds to explore proofs of concepts for these critical infrastructures that we're going to need in health and care, that are very critical because they're going to need to be able to share the data very securely. And some of the work on data that we're already doing and will continue is the work on genomics, for example, for which artificial intelligence and high performance capacity is critical if we're going to really be able to bring the potential of research based on genomics into clinical care and support for patient care and research, because this requires an ability in a federated system for algorithms to travel across the EU and pick up this very, very sensitive data securely from member states. So we plan to put, for example, budgets towards projects that will look at the specific kinds of infrastructure that can make that happen. And we have other kinds of data that we're developing too. I mean, knowing of course that this is all essential for really maximizing what we want to do on artificial intelligence. We've got major projects at the moment looking to develop repositories of anonymized cancer images, and then look to bring these together to create a very large resource of cancer images that can be put towards all different kinds of cancer care. And then last but not least, of course, during the course of this year, the Commission is working on a proposal, a legislative proposal for the European health data space that's planned for adoption at the end of 2021. So during the course of this year, we will bring all these elements together, the overarching elements on data, what's already been planned on health, and put it all into a specific legislative proposal. There's currently a public consultation open, if you're interested, that's open until the 3rd of February. And I can make sure that you receive the link to share to anyone interested in the audience, or perhaps I can put it into the chat while the discussion's happening. So that was a quick run through in the time available in terms of what the European level is doing for the European health data space.
Thank you very much, Sari. And I think that, again, for the interest of time, we try to kind of compile all of the questions we'd like to ask to each of you, and of course, including from the audience. So we can maybe, with this very informative insights, Sari, that you just shared, maybe now move on to Dr. Boifa Lubnar, and our colleague give you the floor.
Thank you very much, Christophe. Thank you, everyone. Thank you for having me here today. So prior to the pandemic took place, as Kerry said, I spent a lot of time in Brussels with my other colleagues, 52 experts across Europe, working on the ethical guidelines for the use of AI, and also on the policy recommendations. And if you could see, you know, the world changed overnight in March, and all those recommendations around we need to move to agility, to using data more, it started happening. The COVID data starts streaming, and policymakers and in healthcare, the data was used to take decisions, to take new measures. Yeah, sorry, I'm just gonna mute. Gary, can you please mute your, yeah, no, so sorry, I can just hear the typing. So, and what happened is that in 2020, the world has changed, and you know, it's not gonna go back to what it was. I think we can all agree that COVID-19 showed that we were relying on some dysfunctional linear measures in our decision making. So everything from, you know, the lack of PPEs at the beginning to the robustness of the government's guidelines in the different member states brought a lot of uncertainty to our lives. And we saw that the virus has no borders, but you know, neighbor member states has completely different responses to this pandemic. And as with the current state that every week we have a new variant that's discovered, this uncertainty is unlikely to disappear. So this crisis we currently immersed has changed the rules of the world, and we don't have the luxury to discontinue our relentless way of doing things. So we must learn and adapt. And when it comes to finding the right solutions in healthcare and outside healthcare, we need to drive competitiveness, you know, by collecting data and sharing more data, creating and adopting scalable technologies such as AI that help us reduce this uncertainty, and by moving from just the back seat to the driver's seat. And in the life science industry, where my company Okra Technologies is building AI solutions, supporting pharmaceutical companies in speeding up the drug delivery to the patients, we have been in this industry under pressure to deliver the vaccines that will help end this crisis. Both, and they need to be both, you know, safe enough, efficacious, and also we need to deliver as quick as possible. What happened is that, and then as you all of you know, that we moved the industry from a 10 years average to 10 months to develop and deliver this vaccine. And you know, the question is, can we maintain the speed in the drug development process for the future? Is it possible to reduce this uncertainty so that we can tolerate more risk and get drugs to patients more quickly in the future? You know, certainly, you know, in the post-COVID world, it would be a huge shame if we go back to the centralized approach, the slow and the lengthy bureaucratic development process instead. So we will use more technology and shift to adaptive and faster studies like we did in this period to approve new treatments more rapidly. And now that there is greater spotlight on life sciences, how can we handle the ethical dilemma that we can afford to hold a drug that saves lives from getting to the right patients due to unnecessary, slow, and lengthy bureaucratic processes? And don't forget, citizens were so close to this process, so everyone is asking, why is it taking so long? And we all know that the one country is far ahead of all others in providing vaccines, so Israel. And if you take a look to Israel, why they had such quick rollouts, especially in the country with, you know, is it because they got used to a state of emergency, or because they have a good healthcare system? But the key reason is because they have a good health data. well coordinated and obtainable health data, and they leverage that in the deal with the pharmaceutical companies to use it for real world efficacy measures of the new vaccines. And that's why they got such a rollout. And so they have benefited enormously on multiple fronts as a result. So in today's world, the rules change, are not the same. Data is the new currency, having, especially in healthcare. You know, the industry stakeholders, they don't own the data. The data is owned by the public sector, and we need that real world evidence to move forward. So having good quality data is very crucial to move forward. And we saw it with the vaccines. The countries that got the good supplies are the countries with the good data. Yeah, so comparing this to Europe, different member states where we are discussing a lot of initiatives where the supplies have been delayed, is there anything we can do? Well, of course, and I'm really happy that Kerry mentioned before about European Health Data Space. Also, my company Okra, we are using AI technology exactly on the right side of the pipeline to bring this drug faster. And AI is the perfect technology to do that and to reduce uncertainty. But to work, AI relies on good data, and it can only be effective if we provide the right data. So if Israel can do it, so we can. So we urgently need to fix this problem in Europe. And thankfully, there is good progress on our way. The European Health Data Space emerged to ensure access to different types of data, and we're really looking from industry, from innovative companies, we're really looking towards the output of this initiative. And I personally believe it's one of the most important projects that's happening in the continent. Each of us has a duty to support the creation of data in Europe to make it more attractive destination for understanding and responding to health needs. And AI can help us thrive and benefit us in there. So for me, it's what is really crucial to three key strategies for this health data initiative is to collect data with the right level of granularity that allows us to train those algorithms and that allows us to refresh those algorithms regularly. And also the second thing is to ensure that data access, not only for research, but also for innovative companies and European companies with next to, and of course, the other stakeholders in the ecosystem, to allow us to move to value-based healthcare as well, and to drive change in healthcare space. And last but not least, increase the adoption of AI and adopting the ethical guidelines for trustworthy AI in Europe is the key. So just to summarize, the world is far more certain, and we can either suffer from this uncertainty or we can leverage it with data. And if we can collect, the 90% of the data we have today is generated only in the last 2 years. So it's never too late to start. So we can generate a lot of data in the next few years and create a competitive continent that leverages data to move healthcare outcomes here. So thank you very much.
Thank you, Lubna. Very inspiring messages, and thanks for sharing all of this with us. I'm going to hand it over now to you, Michele.
Yes, thanks, Christophe, and of course, always hard to come after Kerry and Lubna's presentation. But I will try to actually bring in, the patient perspective in the discussion. As you know, APF is a membership organization, is an independent umbrella patient organization that brings together the views of both European disease-specific organizations and national coalitions. And of course, we are engaged a lot in all the key health policy topic areas. And clearly, as was mentioned several times before, digital is one of these key topics, and it's going to be even more topical coming in 2021, in the next 12 months, in particular for all the updates that have been shared, and we are really engaged on so far. So on the point of digitalization, digitalization is clearly important for the patient community because it has a lot of impact on several elements of patients' life. It goes in terms of empowering patients, you know, the access to their own data, self-management, quality of life. It's also a way to improve the integration of healthcare systems towards a more person-centered and joined-up care and well-coordinated. It also has clear impact on improving quality and access and timely research in the healthcare sector to a more decision-making participative process. And of course, it can lead to a lot of health system improvements. And you know, the example of what happened during COVID is clear of the potential that data AI can have in the healthcare sector. And it's also very much linked to how patients can use and use information and increase their level of literacy and awareness on their conditions and how to interact with the healthcare sector. In terms of artificial intelligence, which is what I'm going to focus on for this brief intervention, indeed, many of you already mentioned what are the key things where everyone looking forward to the potential impact that can have on improving population health, healthcare operations, healthcare related innovation, and on patients. It has a lot of impact, and it can have even like more positive impact in terms of, again, self-care, prevention, wellness, diagnosis, diagnostic, clinical support, and of course, research and innovation. Of course, for the patient community, also given the nature of the topic in itself, there are a series of let's say challenges that needs to be taken into consideration that we believe were also already initially addressed in the recent work of the European Commission, for example, on the white paper that was published last year, but also in the data strategy, and of course in the first plans on the European health data space, on which we will also send a consultation, as was previously mentioned. In terms of AI and patient care, basically the challenges that we still need to see, and we want to have address also in the future work at the European level. Of course, what was mentioned before, the importance of data quality, because that's really fundamental for having a good functioning and efficient artificial intelligence. Also, framework that can really ensure improved trust in a way to increase reliability and safety and transparency around artificial intelligence and the data that is used and generated. The ethical issues, of course, there's been a lot of work already, and going forward, there are still ethical challenges that need to be taken into consideration. And also a particular issue for patients is, of course, the question in terms of how AI can better integrate with the patient relation with healthcare professionals. All these information that I just shared with you were actually confirmed in a consultation that we had last year with the EPF patient organization community, where we really tried to gather to improve, let's say, the level of knowledge on this topic by the patient community. We really tried to gather the key views on some of the main elements connected to artificial intelligence. And we actually explored, for example, the perceived knowledge on AI from the patient community, which at this moment, it's still fairly basic and with only few examples of really good high-level knowledge. And also, this is connected to the understanding of where AI plays a role in healthcare, which of course can lead to slowing down potentially the trust that the patient can have in artificial intelligence, or in the understanding of the impact and the positive impact that it can have. Of course, patients themselves recognize the great potential of artificial intelligence, and mainly, and this was all very interesting, how AI can really improve the way that healthcare professionals and patients can communicate to each other, can help each other to have more personalized care. There's a lot of recognition on the importance of AI in the sphere of self-care, clearly also on improving quality and efficiency of diagnosis and research and innovation of innovation in healthcare, of course, and of course at level of improving health systems efficiency and delivery of care. Clearly, our survey also identifies some of the challenges that the patient community still see in the application of artificial intelligence in healthcare. I mentioned already some of them. So the question on really how it will basically match the relation with the healthcare professionals, the need of clear frameworks to really understand if something goes wrong, what patient can do when there is care related to application of AI in healthcare. The question of transparency, of course, is very important because it can improve trust, which is fundamental to have patients more engaged in the discussion on artificial intelligence, and therefore also help innovators to better co-design solutions that are even closer to the patient needs and therefore more potentially more used. And this discussion, of course, leads also to the need of more information and literacy on this topic, and it's clear how the plans of the Commission are already including this element, and this is a clear welcome addition. It also leads to basically what was our response to the white paper on artificial intelligence, and basically, and I'm going to close on this, the key elements of what EPF is going to look at in the work on AI going forward, which means, of course, addressing the challenges that I mentioned before, and they're clearly still there in the application of AI and data in healthcare. The importance really of ensuring stronger data in Europe to improve AI as well, developing this ecosystem of trust and excellence in healthcare, which will really support, the framework that the Commission is already putting on this, better European coordination. As with the European health data space, it's really important to move forward as harmonized at harmonized European level as much as possible, because this is also linked to how patients can travel across countries. The importance of boosting skills and literacy at digital health level to really improve the trust of patients in health systems, in health data, and in digital health in general. The importance to look at the potential risks. They are related, of course, to the application of AI and digital healthcare, digital health, and digital in health, which are still there, and it's another element that can, have an impact on the trust of patient. And of course, really a fit-for-purpose framework that can also take into consideration the very rapid evolution of digital health in the coming period. So just to conclude, indeed, there's a lot of recognition of the importance of digital health on AI. We're really looking forward to work with the Commission and all the other stakeholders in the coming months to bring in the patient perspective in the discussion, mainly because, of course, everything that is about patients should also be co-developed together with patients to make sure that there's really a framework that can be used, is trustworthy, and can really improve healthcare, tackling all the main issues that are still out there.
Very, very important insight, Michele. Thank you very much for sharing all of that with us. And before giving the floor to Joao as the next speaker, we just wanted to acknowledge the presence of our second MEP, Sean Kelly, who actually joined us some minutes ago. So welcome on board to this webinar, Mr. Kelly, and we'll actually have you with us for actually hearing your insights during the second part of this webinar. With that being said, Joao, I think the floor is yours for your own intervention.
Thank you very much, Chris. And again, thank you so much for all the speakers, because, I had three small points to address here. But, for example, the first one was so excellently presented by Lubna, which was really the impact of COVID-19 on the topic. That it's great, because one thing I was going to say in the beginning is, necessity is the mother of invention. I think we all have that saying in every single European language. And I think COVID really shows and motivates us to understand how can we have a better data system and a better infrastructure in our continent going forward. And I think, when all of this is over, I think the biggest motivation we have right now is what kind of infrastructure and system do you want to have for the next pandemic, which hopefully will be very far away in time, to address it in a more consistent and in a more unified way. And COVID-19 has brought a lot of challenges. I'm here representing the pharmaceutical industry and trying to give a bit the perspective of pharmaceutical R&D, which, as Lubna said, has been greatly accelerated by COVID-19, not only on the therapeutics, but particularly, as you saw, on the vaccines. Many companies scrambling to get clinical trial data to make sure that you find interesting solutions for this pandemic. And one thing that we need to address is it's the triangle around AI, data, and digital health. And sometimes these are spoken on in isolation somehow, but there isn't one that exists without the other two. And so, and I think Lubna also mentioned this, we need good quality data to have meaningful AI analysis, to have meaningful analytics. And of course, these need to be tackled, in a very consistent way by all stakeholders in a consolidated way in the European Union. And from the pharmaceutical drug development perspective, one thing that we have been seeing many times, Kerry has mentioned it as well, we have seen the power of artificial intelligence and data analytics in things such as diagnostics, in biogenomics, in computerized biology as well, trying to make sure that not only necessarily we cut time in a lot of steps that are very long in drug development, but also these are much more targeted, precise, and we actually make modern drug development a reality going forward. And I'm a regulatory person. I work for the pharmaceutical industry, and I'm in the regulation side of things. One thing that is also very positive as well is seeing the increase in education and awareness amongst all stakeholders. And Michele, thank you so much for sharing also the patient's perspective, because as a key stakeholder in the middle of it is, of course, patients need to have that awareness about the power of AI and digital health. We also see, for example, that regulators themselves have been more increasingly understanding, learning the power, the potential of digital health, and also very openly acknowledging and supporting the development of digital tools. As you can see, for example, in EMA's regulatory science strategy, there are specific priorities on how the EMA wants to support not only digital health, but also specifically using artificial intelligence for helping with regulatory decision making, trying to get the right evidence and bringing significance to it, because of course data brings noise, and of course we need to make decisions based on the best quality data available. And so you can see that not only in EMA's regulatory science strategy, there's also medicines agencies network strategy that includes digital health ambitions and also use of artificial intelligence. And all these are very important because more and more the pharmaceutical industry is harnessing the potential of these tools to modernize drug development. And so a last point I would like to give here as well is, of course, there are ethical considerations that need to be taken into account. But in order to really have a unified field and a unified health union, so to say, we need to take this into account, really try to understand where to gain the efficiencies and break down those barriers that have been listed by my colleague panelists, and really make sure we understand that we cannot have outcomes-based medicine if we cannot measure those outcomes, if the data is immature, and more importantly, if the data remains fragmented across different countries. Even though that diversity, that fragmentation sometimes is also the beauty of the European Union, it can really help if we do bring that together in a more interoperable space. And last and not least, three things. Investment is very important. Small, medium companies need investment and support to really ensure not only that they can use new tools to support the drug development and even device development and software, but they also can access public infrastructure and get that guidance to ensure that they are able to use and collaborate across. collaboration in all stakeholders. As Michele said, we need to be all stakeholders around the table. We cannot make advancing this health union if we do not have a consistent, unified voice and discussions along the way. And finally, it's a multi-stakeholder discussion. It's not a pharmaceutical discussion or a device discussion or a digital technology. All these private sectors need to be together and learn from each other, because only that we can work with policymakers to ensure that the patients are benefiting from all these tools at the end. So those are just my 3 thoughts. So thank you so much.
Thank you very much, Joao, and actually even be just 3. I think they are just essential to the debate, and actually thanks for emphasizing all of this. Laurent, I believe we have, in order to close that first session of the webinar and before moving to the next, at least a few questions, at least one I think we would like to raise to the speaker from the audience.
Absolutely, Christophe, and indeed we have time for one question, and this question is, I think, for you, Kerry, a question from the floor from François Xavier from the Council of Europe, EDQM. I think it's a very good question. I mean, he says, well, basically, how the EU Commission sees the pharmaceutical regulation on medicines, including classification of OTC products, online sales, or electronic prescription, regulating the upcoming e-health changes. So basically, how do you see, I guess, the interplay between the quite busy framework for pharmaceutical regulations in Europe, with the e-health or digital health changes?
Thanks very much for the question. I'm going to answer in a very general way, because I think there's maybe a precise answer which the team working on this will give you. But I mean, in general, I think, digital transformation is a horizontal exercise. So it's cutting through all the sectors of society, the pharmaceutical sector, health sector, transport, energy. So for example, so of course this isn't being met everywhere. How do you've got different trains leaving the station? How do you make sure that it's to some extent it's a coordination issue. In relation to in the pharmaceutical, how the Commission always deals with development of strategies is that it's done as a very much across DG and consultative process. So, and there's a lot of discussion beforehand to make sure that what different DGs envisage in relation to policy is sufficiently coordinated and intertwined, and it makes sense and it's coherent and it fits with what the other stakeholders are doing. Sometimes on the other hand, you have situations where colleagues working on the regulation for artificial intelligence, of course, it's regulation that will land across all the sectors. So I think to a certain extent they're working with individual sectors, pharmaceutical sectors, others, to make sure that the parts that will relate to them is easily going to be taken up by the sector post-adoption. So the precise aspects of the OTC issue in pharmaceuticals I can't give you, but this is generally I think it's a coordination issue and a coherence issue, and it's in part dealt with by sort of intellectual coherence you get from the way the Commission develops its proposals all together with other DGs. Yes, and then ensuring that everything gets highly scrutinized internally to make sure it's coherence.
All right, thank you very much, Kerry. I think this is you did a very good answer, I think, and we are really right on time. So I'm really glad to hand over to you again, Christophe, to introduce the panel with our MEPs, and then we'll also have some time for Q&A after the debate with the MEPs. Thank you, Christophe.
With great pleasure, Laurent, and indeed we're now going to move to that next section of our webinar, dealing with an exchange of views between our members of the European Parliament. So we indeed very honored to have two of them with us today. First one being Mr. Sean Kelly. which is actually an Irish politician who has been a member of the European Parliament since 29. And he's currently serving as a member of the Committee on Industry, Research and Energy, and as a substitute of the Committee on International Trade, where he has been leading the discussion on the EU SME strategy. Moreover, Michele actually also sits in the intergroup on artificial intelligence and digital. So thank you very much, Mr. Kelly, to be with us. And as briefly introduced prior, just wanted to give a bit more information regarding Mrs. Djokovic too. Mr. Djokovic joined the European Parliament in 2011 and basically served an analytical group on gender research and innovation of the European Commission between 2012 and 2016. And basically, she currently serves as a full member of the Committee on Industry, Research and Energy and a substitute member of the Committee on the Environment, Public Health and Food Safety. So with this brief introduction and knowing, Mr. Kelly, that in particular you can only be remaining with us for a short period of time, I think we can really kick off the discussion with you, if you agree, and just be asking you, in your opinion, how can policymakers address the challenges faced by SMEs in accessing capital, data, and skills to develop AI solutions in health?
Thank you very much, Christophe, and I must say I'd like to thank all of today's panelists for what has been a very interesting discussion from a range of perspectives. So I'd like to thank the organisers as well for inviting me to be part of this event and for the great work they do representing SMEs in the healthcare sector. Today's event brings together a number of issues that are important to me. SMEs, facilitating innovation, data, and of course health, which has never been such a priority. The COVID-19 pandemic has given us a greater appreciation for all those working in the healthcare sector and reminded us that the health of our citizens is at the heart of our union. AI is a great tool that can be used to deliver new solutions and improvements in healthcare. As policymakers, we are committed to removing barriers and supporting innovation in this area. As part of my work as a member of the Industry, Research and Energy Committee in the European Parliament, I try to ensure that SMEs are supported. I understand that SMEs face unique challenges across sectors, and therefore policymakers must consider their needs from the outset, not as an afterthought. For example, in the healthcare sector, larger companies often have more resources to dedicate to compiling databases or navigating complex technology law requirements. But these issues can be huge barriers to SMEs interested in developing in the AI space. Data is the starting point for any research project, and it's crucial in order to train AI. As I was a key negotiator for the EPP group on the GDPR, which protects personal data rights and recognizes health data as a special category, the GDPR introduced one law on data protection, making it easier and cheaper for companies to operate in Europe. Fostering innovation in healthcare and protecting sensitive personal data of individuals were two key priorities when the regulation was being negotiated. An interesting point raised in the white paper is that end users need to be supported to adopt new AI-based solutions. While crucial, this can be overlooked. What good is developing AI solutions if workers do not choose to implement them? We have the same problem now with vaccines. We're spending billions and billions on developing vaccines for COVID-19, but we have also to convince the citizens that it's in their interest to take them, and many do not want to do so. People can be slow to change the way they have always done things. Training and education on disruptive technologies is therefore vital, both for those already in the workforce and the next generation. I'm a long-time supporter of the Coder Dojo initiative, which teaches young people how to program. Those who take part are taught to embrace the ever-changing technology of our modern world, and it's a unique and wonderful success, growing worldwide now, having started in Cork less than 20 years ago. Thank you again to EUCOPE for including me in this wonderful event. Their white paper and the interventions of the excellent panelists today were both very informative. I'm glad this event and the white paper provided a forum to draw attention to and to discuss the specific barriers that SMEs in the healthcare sector are facing in adopting AI solutions. And I'll conclude by saying this topic is only beginning, not ending. But we are beginning, I think, in the right fashion by including as many people as possible in the discussions, and that's the way we'll get proper legislation at European level, which, like the GDPR, will become a world leader in due course. So thank you very much, and best of luck to all the panelists.
Thank you very much, Mr. Kelly, for these very insightful thoughts and comments. I believe again that we have to let you go soon due to all the commitment at your end, but we thank you again for your kind contribution. I think we can move, Laurent, if you agree, to our last speaker for today, being Mrs. Jakovic. So if this is actually fine with all of us, again, just to I would say kick off the exchange. The question we would like to ask to you, Mr. Jakovic, is actually, in your view, how can the EU facilitate the implementation of AI-based diagnostics and personalized medicine in health systems across Europe?
Thank you, Christophe. Thank you for organizing this webinar and for inviting me. This is an excellent topic and coming in the right time. You know, I couldn't agree more with something that Lobna said at the beginning. She said that the world is changing, and indeed is changing rapidly. The magnitude and the speed of this change are unprecedented. Where will we be in 6 months, a year, or 10 years? Who knows? But we are witnessing a great reconstructioning. This coronavirus is really multi-dimensional, and this is not only a health crisis of immense proportion. It is also an imminent restructuring of the global political and economic order. And as we struggle to find answers on so many questions, one thing is certain: nothing will be the same again. There will be no going back to the old normal. I believe this great restructuring is Europe's moment, an opportunity to write a new chapter. And this is the moment for us to find an economically and socially viable path to the next normal, you know, an opportunity above all to build foundations for a Europe which prioritizes social well-being and economic equality. Europe which rests on solidarity, inclusiveness, and sustainability. This coronavirus has been called the great equalizer. It is a disease that really transcends wealth and fame and prestige and age. In front of the virus, we are all the same. We are all at the same risk. But on the other hand, virus has amplified existing health inequalities and revealed many shortcomings in our health systems. At the same time, it has shown us very clearly how fundamentally important digital technologies have become in our daily lives. This pandemic really has acted as a catalyst, forcing us to re-examine our priorities, while at the same time pushing us to find innovative solutions that can help us adapt to this new normal. If anything, one positive unintended consequence of this pandemic is that it is boosting innovation. It is pushing us to be more creative, more cooperative, and helping us set out priorities better and right. I am glad that the Parliament repeated calls during the negotiation on the new long-term budget and the new generation for more funding for health, for research and innovation, and the twin digital and green transition have paid off. Now we need to use these new financial resources wisely in order to expand our collective capacity for research and innovation, and to make our health systems more resilient and to boost our preparedness for the next pandemics. Another important element of the debate on how to better position Europe vis-a-vis its global competitors is in the post-pandemic war was the strategic autonomy. We are witnessing now the emergence of the vaccination wars, but we must ask ourselves, how did we get to a position where we cannot guarantee a supply and access to vaccination to our citizens? How is it that we are not capable of bringing to the market innovative solutions just as fast, if not faster, than our global competitors? So what can EU do now to facilitate the implementation of artificial intelligence-based diagnostics and personalized medicine in health system across Europe? Well, when we talk about the implementation, what I find is crucial is how to enable the access to data. This is the key precondition for the development of data economy, and in the health sector, a strong European health data space could improve exchange of critical data and could lead to better research and innovation outcomes. If we want artificial intelligence to develop and scale it up here in Europe, we need to create a legislative framework which will unlock the value of data, support the use, reuse and exchange of health data, foster harmonization of digital standards at the EU level, and I mean across Europe, address safety and liability related aspects of artificial intelligence in order to ensure a high quality healthcare and to reduce inequalities. So I believe it's now clear to everyone that if we had access to critical data in the first wave of this pandemic, we could have saved many more lives. And going forward, I believe that the new artificial intelligence framework and the Data Act present an opportunity to support the industry in their efforts to be more innovative and globally competitive by creating a legislative environment which is stimulating rather than too prescriptive. We must also focus on retraining and reskilling of healthcare professionals in order to bridge the skills gap, but also to encourage our graduates for careers in ICT.
Thank you very much to both of you, Mrs. Jakovic and Mr. Kelly, for sharing this very inspiring insight with the audience. Laurent, do we have actually any questions we'd like to raise from the audience for speakers?
Not yet, but I may actually have one on maybe on behalf of EUCOPE, if I may, for you and maybe Jokovic. I think it's as an MEP, and also, I mean, you have been also active at I think in the national at the national parliament as well. I mean, one of the key aspects is really, for AI to be really efficient, or for digital data or digital health to be really efficient, is to have the adherence, the adhesion of the population of the patients. I mean, and what do you think? I mean, how can the policymakers, I mean, I know, maybe enable or increase that adoption of the patient population of and increase the trust as well of the patient population. And maybe if we have time, I mean, it is also for Michele as well as EPF. But that's just one. Really, your thought as an MEP, as an elected policy maker.
Well, how can policymakers address the challenges? Well, facilitating SMEs access to capital, data, and skills should be an important EU policy priority. I think that it has to be in the focus of the European Commission and European Parliament. The adoption of AI technologies may significantly boost the European economy, but a considerable part of this impact is at risk if SMEs fail to adopt the new technology. I think here we have a very real risk that SMEs will be left behind in the digital transformation of healthcare, and that only the big companies with the know-how and with the financial power will be the one reaping the benefits. So in fact, a recent survey on only 7% of healthcare and pharmaceutical companies said that they have gone digital compared to 15% of companies in other industries. So I think that a great responsibility rests on the European Parliament, who must ensure that the Commission continues to support the digital transformation of SMEs by ensuring adequate access to the financial investment in digitalization through the COVID-19 recovery plan.
Thank you very much. I think we have maybe 1 minute left in the Q&A. I don't see any further questions, so Christophe, maybe up to you to for Alex for the closing remarks.
Okay, no problem, Laurent. And just to stick to the time, indeed, we will now like to again hand it over to you, Alexander, for some concluding remarks.
Thank you very much, Christophe. I have to say I've had great, we've had great interventions today with really concrete input from the many stakeholders involved. Ambassador Lurti was very clear in the Portuguese, on the Portuguese presidency ambition to accompany the Commission's effort in putting AI and digital health very high on the agenda. And this is very much appreciated. We can all agree with this point on sharing data and leveraging information to help member states in improving their healthcare systems. The sentiment is echoed by the Commission's plan to put forward an ambitious EU health data space, but also the European Health Union to support all stakeholders in achieving a greater digitalization of health. The first panel gave us real concrete examples from Lubna to Joao on the business and industry expectations to realize the full potential of digital health and AI, including also taking the opportunity of COVID-19 crisis can also offer despite the set situation we are all in. Michele stressed the important perspective from the patients, crucial in setting up realistic goals for AI and digital health, and gave us some insights on the expectations from patients to improve, hopefully, adoption and adherence in digital health services. Finally, we had excellent remarks from MEPs Djokovic and Kelly, highlighting the important role of the European Parliament, the important role the European Parliament will play in the upcoming legislative milestones ahead of us. I want to thank all of you speakers and the audience today, Christophe for moderating the event, Laurent and Nove for organizing the events. We will share with you the EUCOPE white paper on AI, as well as any supporting document from today's meetings. Have a great day, and once again, thank you all for being with us today.
Thank you.
Thank you.
Thank
Thank
you.
you all. Thank you. Bye-bye.
Thank you. Bye. Thank you, everyone.
Bye.